All right, everyone, welcome back to Unsaid. I am your host, Catie Whiting, and we are super excited today as we have another Catie on the podcast. There's just something about Caties. I don't know. Maybe I'm biased, but we're extra sassy or something. But we're continuing in season 3, really honing in on motherhood and pregnancy, postpartum, the grief that comes along with that. That can be loss of time, loss of sense of self, and infertility and IVF. And we've had a plethora already of great professionals and experts in the field, specialists and things. And Catie brings us her own story and her own expertise in infertility and IVF and all the things around that. So, first of all, Catie, thank you so much for your time and being on the show with us
Yeah.
today.
Thank you for having me. I'm excited to
Absolutely.
be here.
Yes, yes. We're very excited to have you. Catie, tell us about, listeners always want to know, who are you and why maternal mental health? So guide us there.
Yeah. So I'm Catie Kirkenmeier. I have a private practice. I'm a therapist, an LPC, LCPC in Kansas City, Missouri. And I specialize in perinatal mental health and infertility. And I kind of got into this work sort of through my own experience. But so I had my own journey with infertility and then also my own journey with postpartum anxiety.
Mhm.
And when I was going through that, even as a therapist, had a very hard time finding adequate support and adequate resources. And so that left me feeling like, okay, there's a need for this, right?
Yeah.
And so I wanted to dive into that. And so that led me to opening my own practice and diving into specializing in this.
Yes. Yes. We're very glad you did. And we're glad you're here. What makes you specialize in it? As in, what makes you beyond the story? I'm not saying that question correctly, but the expert.
Yeah. So, yes, I mean, everybody has their own experience, obviously, their own journey with infertility. It can look a lot of different ways, right? There's sort of primary infertility, secondary infertility. So, struggling to get pregnant after you've already had a child. And there's lots of different ways to be struggling, right?
Yeah.
Lots of different avenues to try to have a baby. But I think because infertility is so isolating, when you go through it, you really want to experience some sort of connection with someone else. And so when you've lived it, you kind of want to be like, oh, yeah, me too. This was my experience, right? Because you feel so isolated. Anybody that's you really experienced it, you really want to kind of latch on to that. But I think that that doesn't always leave a ton of space for understanding that there's a huge range of experiences with infertility. So, yes, I have my own experience, but I wanted to make sure I was not just living that one
Yeah.
little sort of type of infertility. So after that, I kind of, I went through the perinatal mental health certification track and then also went through the American Society for Reproductive
Yeah.
Medicine's trainings for mental health professionals and did their certificate program. And then working really closely in their mentorship group with and going through, having monthly meetings with a mentor to make sure I'm really doing the ethical and right
Yeah.
thing. And then I also just finished a year-long reproductive psychology course,
Oh, wow.
which was awesome too. That kind of really dove a little bit deeper into infertility too. So always trying to make sure I'm staying on top of it and not just drawing from my own experience
Yeah.
too, I think is really important so that I can
Absolutely.
be a safe space for clients. Yeah.
Absolutely. No, I think it's beautiful. And thank you for doing all
Yeah.
that because there's so
Yeah.
much extra work. I mean, extra training, I should say, that therapists and providers have to do to really specialize in versus just their own story. So, a lot of our listeners, my friends, my clients, right, miscarriages, are having miscarriages and one, two, three, I mean, multiple beyond. And there's so much that goes with it when they're really and I'm coming in like trying to come in through like the ignorant lens is like when they're really early on in pregnancy, it's sort of this feeling to brush it off. It happens to all of us and things like that. So through your practice and your scope, like what do you see being the hardship within the miscarriage world for moms in particular? And let's dive into that.
I mean, I think there's so much grief,
Yeah.
obviously. And I think especially when we talk about miscarriage, right? Typically that's happening earlier in
Right.
pregnancy. And so there's so much and I see this in infertility too, of how can I feel grief about something that was so like that was so
Yeah.
early
So
on,
early on.
right? And that can be such a struggle too.
So I have a family member who was baby number 2. So baby number 1, like, was a, "Oops, I'm pregnant. I didn't even try." And then baby number 2, and I think it was at the 12-week mark, there wasn't a heartbeat. And so, that happens and the excitement has already been, right? Because because this isn't even baby number 1. There's loss, and people seem, and this happens a lot in grief, so you can tell me more, but people seem to surround for a minute, right? Like, "What can I do for you? What can I do?" But people have to get back to their lives, right? And so they come out and then they go zing, and then the mother, right, the person of loss, and the whole family and the father too, but like the mother is like, "What do I feel? Like I feel gross. Like I could be 6 months pregnant." So when I say the hardship wasn't the right word, the complexity of it, like I just want to break that apart a little bit so that it's normalizing and validating.
And so, yes, there's so many layers to it,
I
right? And you
know.
bring up such a great point that if someone has disclosed that they're pregnant,
Yeah.
right, then there's the having to tell,
Yeah.
right? And that can feel hard. But if we haven't disclosed,
Yeah.
that can be hard too.
Yeah.
But beyond that, right, the grief is so pervasive, right? Because it's not
Mm,
just, okay, we had a loss, right? It's okay. I mean, unfortunately, not unfortunately and unfortunately,
yeah.
right? Like we live in a world where pregnancy is always around. Children are always going to be around. So there are constant
Mm,
reminders, right? Everywhere you go. And so there's comparison of, "Well, I wonder how far along this person is.
yeah.
Where would they have been?" Or, sometimes we see this. Obviously, if you're in a stage of growing your family,
Yeah.
then likely your peers are, right?
Right.
And so oftentimes your friends or family members are also could be pregnant at the same time. And so seeing that or seeing people have healthy pregnancy, healthy baby can be really triggering. Going to baby showers is really
Yeah.
hard, right? And then there's the anniversaries too, right?
Yeah.
It's not that just that initial loss. It's okay, this is the due date and how hard that is every single year. Or this is the anniversary of the loss date of when
Yeah.
I found out, right? And oftentimes there's a ton of trauma in an ultrasound room
Yes.
on that too. And so then with subsequent pregnancies or trying to get pregnant, right, there's trauma there. It's really challenging to be in that room. And so it's not just a one and done, right?
Yeah.
Unfortunately.
Yeah.
The grief is so pervasive. There's such a big ripple effect.
Yeah, pervasive is such a good word. No one has used that word yet, so I appreciate that. And thank you for bringing up, the ultrasound room, but the doctor's office in general. Like so many moms have shared a story with me where they go to have the ultrasound at like the 12-week mark, and the ultrasound tech, right, is like you can see the look on their face. And so then they go into future appointments and they're just like waiting. Did the ultrasound tech look at me wrong? So trauma. So bring that in a little bit more if you don't mind. In your practice, again, specifically around like miscarriages and thing, attach trauma to that so people get an idea of what this really does to the brain.
Yeah, so I'm thinking of a client who's had a recurrent pregnancy loss. She's
Yeah.
had a lot of the secondary infertility and has had a
Yes.
lot of recurrent pregnancy loss. And the ultrasound room in particular
Yeah.
is very, very triggering for her. She's
Yes.
had panic attacks kind of going into the ultrasound room. So, our brains kind of they take snapshots,
Yeah.
right? There's a reason we can't remember what we had for breakfast yesterday, but we can maybe remember a car accident,
That's right.
right? When we were 16. And so our brains are really good at, unfortunately, remembering the hard stuff.
Yeah.
And sometimes we don't even realize, though, the way that trauma gets stored in our body, right? So we might not see something as traumatic, but then we show up to the doctor's office and all of a sudden our heart rate is
Uh-huh.
increasing, right? Or we're having a ton of tension in our body, or our head is starting to hurt, or we're feeling a little bit nauseous, right? And
Yeah.
I don't know what's going on with me, right? So trauma doesn't always look like flashbacks,
Yeah.
right? I think this classic sort of Hollywood story of what PTSD can look
Yeah.
like, right? That's not quite how it always shows
Right.
up. And so, sometimes our brains remember even before we are maybe even fully consciously aware of it in those moments. And so oftentimes our body is letting us know before we're thinking about it.
Yeah.
And then once we've had sort of that primal, right, we're in that trauma mode of kind of like fight, flight, or freeze, it's hard to use those skills that maybe we've been working on in therapy because our prefrontal cortex is offline, right? Where it's hard to use some of that logical, okay, I'm going to pull out of my toolbox and square breathing or use all these things because we're just in survival mode in that moment.
Yeah.
I just have to get through this appointment, but it can feel really scary.
Yeah. Yeah, absolutely. And you use the word in regards to infertility and IVF, but like isolating, right? Like you just feel as if the walls are closing in and no one knows because it's your fight, flight, or freeze. You just got to get through and it's in here. And it looks like that. For the mama that has had multiple right? So multiple pregnancies, multiple miscarriages, like where does that go for you in practice? Like what,
Yeah.
not to pick too much into the therapy room, but what are you doing with that mama? Obviously knowing every story is different.
Totally, yes. So, I have been doing a lot of EMDR.
Yeah.
So, EMDR is eye movement
Mhm.
desensitization and reprocessing, and it works really, really well for allowing us to kind of have some distance from the trauma, right? So, the way I always explain it to clients is we're not trying to erase it. We're not gonna eliminate what happened, right? And especially that can feel really scary when we're talking about a pregnancy loss because we
Ah,
sometimes, right, that those feelings are all we have,
yeah.
right? And so it can feel really hard to let go of some of that. So the way I try to explain it is we're not trying to put the baby right in a box. We're not containing the baby, right?
Yeah.
We're helping it be less intense, right? So that we can talk about it and it doesn't feel so overwhelming, right? Just getting a little bit of space from it and being able to see it and hold space for it in a way that feels like you can function a little bit better,
Yeah.
pack less of a punch, so to speak. Yeah.
Yeah, absolutely. Absolutely. And I a lot of conversations on this topic we've had is just like it never go and I'm going to say it very ignorantly, it never goes away. Like trauma and I mean grief in particular never it's never gone. You're not going to rid of it, but it doesn't you can lessen the intensity of the maybe the pain or the caring.
And I always want to, make space too for, we really want to honor those
Yeah.
losses
That's
too
right.
and continue to make space for them,
That's right.
in whatever capacity
That's
that
right.
feels good to the client, right? I mean, no matter how early the loss was, like that was still a baby,
Yeah.
right? And
Yeah.
continuing to honor them and make space and that's something I do sometimes with art therapy as an art therapist is sometimes we can create artwork that feels like we're
Yeah.
honoring them, and that can feel really lovely too. Or writing like a letter to them and just kind of keeping that for the baby as well,
Yeah, that's
so that we're
beautiful.
we're keeping the memory alive. Yeah.
Absolutely, because our brains so easily want to avoid the discomfort and the dysregulation, and I get it. It's my go-to is like, "Ooh, I don't want to. It's yucky. No, no, no." But to do art and things in this safe space that you provide helps us feel it. And a lot of my clients are, can I process it? But like help us go through these things so that we can be intentional with our thoughts and remembrances. So I love that. That's beautiful. Take us into while there's miscarriages, take us into when it becomes, like, by definition, when you are
Mm,
infertile by definition.
yeah, good question. So yeah, I mean, typically doctors will follow the kind of if you're under 35,
Mhm.
if you've been trying to get pregnant for a year and it's not happening, then we might qualify for infertility. If you're over 35, typically they'll say 6 months. And then from there, when we're talking about recurrent pregnancy loss, so which is also a form of infertility, after two losses is
Okay,
typically when
okay.
they might ask for, okay, let's do a recurrent pregnancy loss blood panel. But so that's sort of a broad
Sure.
definition, but there's lots of things that can happen right on top of that. So if we know, let's say we know there's male factor infertility, right? They might get the fast track, right to IVF
Sure.
versus having to go through the channels of, okay, let's do timed intercourse, let's do medicated cycles, let's do IUI, intrauterine insemination, right? Like, so there's lots of different hoops,
Yeah.
unfortunately, that we jump through sometimes. And it's just dependent upon kind of each couple's story, which is very different. Yeah. Yeah, that's a good question. So typically,
So, it puts it into, a different framework for I'm sure a lot of our listeners, even myself, that it's not just, like, never able to never had a positive pregnancy test, like, let's put that in layman's terms. Like, there's a lot of versions of it, if I may. So when we get to these points of, next level of intervention
mhm,
in the medical community, right? I
yeah,
found a lot of friends, family, and clients feel as if they're like robotic. You go to the doctor and the doctor's like, give me this blood work, and do this and this. So from your perspective and your story, right? Like how do you see that feeling for a lot of women and families, but women in particular?
totally. Yeah, that's such a great question. I think one thing I hear often is so when you see a reproductive endocrinologist, which is that those are the doctors that do the IUI,
Uh-huh.
and like once your OB has taken you so far, right? Like that's
Yes.
where we're going next. That consult can be so overwhelming. Typically, it's a very long appointment. Typically, sometimes it can be several hours. And so oftentimes they're doing labs. In that first appointment, they're doing a transvaginal ultrasound, which can feel very invasive if you've never had one, right? Also, not considering the fact that we have any trauma in the past, right? And then you have the sit down with either a nurse practitioner or the physician, and kind of go through your options. And so I think what I hear a lot is it's so much information and it can be incredibly overwhelming that even though this is that clinic's day to day, that sometimes that doesn't always translate.
Yeah.
And so I think, right, when you're going through infertility, oftentimes you kind of can get to this place where you're like, I'll do anything to have a baby. And so you're not necessarily stopping and pausing, and you're taking in all this information and maybe not even knowing what questions to ask.
Right.
And so it can feel like, okay, well, this is your everyday, but this isn't my everyday, right? I just received news that is earth shattering,
Yeah.
right? Like you're telling me I might have to do IVF, like I can't afford it, right? That's incredibly invasive. There's moral dilemmas involved with that too, right? So it can just feel like such an overwhelming experience. And I think, unfortunately, sometimes the empathy can get lost in the science
Yes.
when we're kind of explaining kind of our options. And that's something I hear a lot, is like, okay, here's your options. This is just the expectation. Like, you'll just do this and then we'll get you a baby. And instead of saying, wait a minute, like, this is a lot. You're
Yeah.
asking a lot of me, right? Financially, physically, emotionally, this is going to be a lot.
Yeah.
Yeah.
No, I think that's great. Empathy lost in the science. That's like a bumper sticker, I think, for some, at least for women's mental health or women's health. Wow, I love it. No, and so, yeah, that's great. Let's go with that. So you have,
Yeah.
an individual, let's just say you have an individual, a client that's coming in the midst of this, right? Where the empathy is lost in the science and it's a lot of talking at that family, that mother, and not a lot of
Yeah.
listening because there's just frankly no time a lot of times in Western
Yep.
medicine for it. What do you want that woman from the mental health perspective to be doing outside of that information gathering to really help her whole body and system through that?
Yeah. I mean, one of the first things I'm encouraging is like, you are going to get a ton of information, but that doesn't mean that you can't advocate for
Yeah.
yourself, right? They might give you a care plan, but that they might say, all right, IVF is your best shot, but that doesn't mean you don't have
Yeah.
options, right? And really saying, well, no, it is okay to say, I would really like to try something else
Yeah.
first, right? And really just not feeling like they can't advocate
Yeah.
for something that isn't feeling good, or slow down, and say, wait a minute, like this feels like too much. So first and foremost, I want them to know they have
Okay.
options, right? Because there is a power dynamic,
Hmm.
unfortunately,
Absolutely.
right? When like they have the information, they have the treatment, like the providers do,
Right.
and then we go in and we're kind of at the mercy of that. But it's your body, right? It's
Yeah.
your body, your experience, your reproductive story. And so,
Right.
what I want them to know first and foremost is that, like, how does this feel to you,
Yeah.
right? How are you feeling about it? Does this align with what you feel comfortable with? Obviously, it doesn't align with maybe what you thought your story was going to look like, right? I
Yeah.
don't think anyone goes into trying to have a family thinking, okay, I'm going to be here. So maybe it doesn't align in that way, but where's your comfort level? Where are your limits and boundaries? And
Yeah.
that's okay.
Yeah, absolutely. No, that's great. So bringing grief to now. So we're in the midst of this. I love it. Like limited empathetic science medicine, which I respect. I respect science and Western medicine in so many ways, but there's a turn and burn mentality a lot of times
Yeah.
these days. So, yeah, tell me for the mother specifically what the grief storylines look like that you see a lot.
I think there's gosh,
I know.
there's so much grief
Yeah.
that comes with this. So first and foremost, right, there's the grieving of what I thought my story was going to look
Yeah.
like, right? How I thought I was going to get to have a family. And that can be, right, like it can be, okay, I don't have a partner and I still want to be a single mom by
Right.
choice. Like, and I still have to go through these avenues of, I'm going through infertility that way. But also, right, I think everybody jokes around about like, oh, trying to have a baby is the fun part,
Yeah.
right?
Yeah.
And when you're going through infertility, it's not. I mean, oftentimes when you're going through infertility, they actively tell you you cannot have sex.
Yeah.
And so, right, there's even grief in the relationship.
Sure.
There's grief of what our relationship looks like with my partner now that we're doing these treatments. Also, there's grief of and that's lost, right? When you are in infertility, sometimes it can feel like your entire world is taken up by that, especially if you're going through IVF. When you're in the egg retrieval process, when you're going through the stimulation phase of stimulating your ovaries, you're going to appointments constantly. You're doing blood draws and ultrasounds can be every other day, every 2 to 3 days, and you're doing injections multiple times a day sometimes, right? And they have to be on a time clock, right? Because if you miss the window, that can impact your results, right? So when you're in it, your whole world revolves around it. So there's grief of like my life, right? I'm having to, and they don't typically let you exercise because they don't want you to have ovarian torsion when you're going through your egg retrieval phase. So there's just grief of so much in that. And so that's even before we've, right, like done the retrieval. And then we get into, right, once we're starting to create embryos potentially, depending on what your views are on when life begins, right? There can be grief there of like we had eggs retrieved, we fertilized them, and there was the growth, arrested on day 3 and they didn't survive past that. Then maybe we get some embryos that make it all the way to day 5 that we're going to transfer, but we transfer them and the transfer doesn't take. And there's loss of that, right? And then right, there's also sometimes if we're doing a frozen embryo transfer, it's rare, but it does happen where the embryo doesn't make it out of the thaw and there's loss there, right? There's so much grief and even the financial aspect of it. I mean, I'm not sure. There are some states that have mandated insurance coverage. Missouri and Kansas are not one of them. So, IVF is really expensive.
Yes.
And so there can be a grief of like, we had this money saved up for a down payment on a house or retirement. I mean, I've had clients that have drawn against their 401k to
Yeah.
pay for IVF. And so, there's grief of like our future, right? Like we might put a ton into this and IVF isn't a guarantee.
Right.
And so what does that mean? So that's why I said, oh, gosh, grief.
Yeah.
Because there's so many layers to
Yes.
grieving in this process.
Yes.
And then on top of it, if you're lucky enough to get pregnant, if you're fortunate enough to get pregnant, oftentimes you're not the first person that finds out you're pregnant. There's a nurse
Yeah.
that reads your blood draw and they call you.
Yeah.
And so even that getting, you don't get to have that like,
Oh,
I get to pee on a stick and show
yeah.
my partner and we get to have this cute reveal. Like you don't like in my experience, I was not the first person to know I was pregnant, right?
Yeah.
And there's grief in that, right? You have these ideas of how I might share with my family or and then when you've gone through loss, clients can be really anxious to share. And so they want to wait a long time, right? So there's grief in that of like, I wanted to have these onesies and share with my parents and I get to, there's grief of like, I don't get to go through this pregnancy just blissfully unaware.
Yeah.
I'm
Yeah.
so aware of all the things that could happen and all the things that can get in the way of preventing this. So yeah, pervasive would be another
Yes.
describing that again. Yeah.
Yeah. And no, I'm like so thankful you took us through. I mean, I know there's so many layers, but you took us through all of it because, I just met with someone who historically worked in like hospice and things. We talked about grief so many times. We look at death grief, and we forget or we don't know that grief is like loss of. That could be loss of what we thought we were going to have, loss of time. Thank you for bringing that up. Like,
Yes.
for all of us, like just time goes
Yes.
by and yes, we could go on and on. So when you see that and people or families, but I'm specifically speaking to mamas are grieving every piece of this puzzle
Yes.
during this infertility journey,
Yeah.
how do you help them?
Yeah. Yeah. So, going back to the isolation
Yeah.
piece, I think people hear if you are willing to share you're going through infertility, people hear infertility and they just go, oh, like they just assume, okay, let's do IVF and it'll be fine.
Yeah.
Right. Or they'll just adopt and it'll be fine.
Yeah.
Which is very problematic thinking.
Yes.
But so there's so much isolation in it. And so I think first and foremost, I want to just create a space that's like everything you're feeling is valid and normal.
Yeah.
And you were allowed to feel that way. Like it was really hard for you. You didn't want to go to like Christmas this year because there are too many little kids around. Okay. Like, yes, absolutely. That's valid.
Yeah.
You shouldn't have to do that. And that's, I do provide some infertility support groups and I love doing that because there is nothing like human connection of someone who's going through something similar to you. And even if your stories are different, right? Just knowing you have this felt sense of loss and longing in the way
Yeah.
that I do is so important. So definitely trying to just provide a space for, yeah, I hear you. This is so hard. And I think there can be some exhaustion too. This is one thing I think I made an Instagram reel about this one time. And it was just like what you want to know what you can do to support, like what's the best thing you can do to
Yeah.
support someone going through infertility. And I said it's just to educate yourself, right? Because I
Mhm.
think clients get really exhausted by having to explain like, well, now we're in this process, we're in the egg retrieval
Yeah.
process, and no, just because we have eggs doesn't mean we have embryos, and there's an exhaustion of
Yeah.
like, I'm already so tired going through this.
Yeah.
I don't want to have to explain it to you. Like I just need support, right? I need to know
Yeah.
that like you hear me and you're there for me and you're not giving me like silver lining statements like at least you know you can get pregnant or at least you can afford IVF or
Yeah.
like, have you thought about this? Have you thought about adoption? So I want to meet them there. And then from there, if there's some blocking beliefs too of like, sometimes we can feel like our bodies have really failed us. And so, we'll do some
Yeah.
EMDR work around that too of, like if they feel like they can't, right? Like I can't stand it. I can't tolerate it. I can't tolerate the fact that I have to go through this to have a
Yeah.
baby. Like, okay, let's dive into that because this can be really traumatic too, right?
Absolutely.
Like, oftentimes I've had clients that okay, we finally got in to see the fertility specialist and we've been waiting a long time, and now I have medical trauma from the way everything unfolded, right?
Yeah.
So yeah, so more trauma work too.
Yeah.
Yeah,
Yeah. Again, layer. I always picture the onion,
yeah,
right? Like a layer and another, and they're stinky layers, and they make you tear. All the
that's such a great
things.
analogy.
So I want to pull in, if you're comfortable now, especially knowing your history of trauma and working with, trauma and sexual assault, abuse, right? Is what you said.
Yeah, I worked in sexual violence for about
Sexual
7 years.
violence. So if we could, and if you can speak to it, like bringing that into the story where someone has a history of sexual trauma and are at this point of life, right? Where maybe they start to have these beliefs that their body's failing, they can't get pregnant, like tie a history of trauma, sexual trauma into, infertility and what you see happening to that whole person.
The idea of even trying to have sex or trying to have intercourse to get pregnant, right? Like after there's been sexual violence
Right.
in and of itself, right, is really
That's right.
challenging. So getting there, right? And even, oftentimes like, getting feeling safer with a partner is
Mhm.
is a can be a less challenging process than like feeling safe in the doctor's
Right.
office. Because right there's that power
Mhm.
differential, and sexual violence is a lot about power and control.
Mhm.
So we're replicating that, unfortunately,
Yeah.
in the doctor's office a lot of times, right?
Interesting.
Where you're so vulnerable, and you're at the mercy of what this provider is doing. And so, and when you're going through infertility, it's a lot of vaginal ultrasounds, right? So there's that which is can be like obviously very, very traumatic,
Yeah.
and especially if your body is tense, right? If anyone's read The Body Keeps Score, right?
Mhm.
We know the body remembers. And so there can be a ton of tension in our body, right? So there's tightness, which can lead, there's pelvic floor tightness from that.
Right.
And we're tense, we're anxious, we're stressed. Our body's already then feeling tight. So then we go in and we have an exam, and then that doesn't feel good because we're stressed. And
Yeah.
so then that we become really stressed about that. And then it's really hard to relax. And so then those medical appointments become even more stressful than they already are, on top of just being
Yeah.
uncomfortable as it is. And so there's the invasiveness of it, right? There's because when we're doing ultrasounds and even right injections, there's can be a loss of power and control too in that, right? Because we're no longer feeling like sex is on our
Mhm.
terms, right? I have to have sex at this time because of the medication. So this no longer becomes like, this doesn't feel like a choice I'm getting to make. Like
Yeah.
I feel like I have to do it in this window in order to give the best chance of pregnancy,
Yes.
right? And so even that loss of choice is huge, right? That
Yeah.
loss of power because we want to restore the power and control
Yeah.
after there's been sexual violence. And this is directly contradicting that when we're saying, no, you have to do it this way. So really thinking about like, so when I'm working with clients, I really talk about like, okay, what do we need so you can feel safest in this? Like, what do we need so you can feel most in control, whether that's with your partner, whether that's in the room, like what, how do you feel about talking to your nurse or your physician, like ahead of time? like, what can we do? Do you want your partner to be there? How can we advocate for this to make this the least stressful experience possible? Because it can be very, very triggering.
Yeah, that I appreciate you going into like what can we do about it because that's such the thing like that somebody said to me in another series we were doing on like perimenopause, but like we don't have to like sit and take it. Like this whole like hold it all in and just suck it up. Like we don't have to do that. But it's a whole different rhetoric we have to put out there, a whole different language that you can
Yeah.
have things, you can advocate and set the standard for yourself. And thank you for just things that stood out to me, like aligning the trigger of the power dynamic between a provider and the patient, similar to, yeah, traumatic history of sexual violence. Like these are things we have to consider. Okay, so I've hit all the topics that I wanted to go through, but we get to so in IVF in particular, because like we do have a lot of listeners with a ton of questions about it. That's a lot of people, like you said, like IVF will fix like it, you'll be fine. You're like, you're in
Yeah.
IVF. So talk to me if you have experience with the individual or the individuals who have done IVF and that has not worked.
So yeah, IVF is not a guarantee.
Yeah.
I mean, statistically, it's more successful than IUI,
Sure.
and it's more successful than intercourse, more cycles or medicated cycles, but it's not a guarantee.
Yeah.
And that can be for a variety of
Mhm.
reasons. It can be because we have low AMH and we have low ovarian reserve, and our egg quality is not super high. It can
Yeah.
be male factor infertility where there's not the sperm isn't sort of taking over
Yeah.
and fertilizing the way that it should and the embryos stop growing. It can, or sometimes I've had clients, unfortunately, who they have unexplained infertility. They've genetically tested their embryos and they get pregnant and can't stay pregnant,
Yeah.
or the transfers just don't work. And so, gosh, that feels so hopeless to say,
Yeah.
but unfortunately, it's not a guarantee. And so, we do talk a lot about like, what is your, because you could go forever,
Sure.
right? Like, if you want to, well, not forever. Most clinics have an age limit
Sure.
when they'll stop you, but like, what is your limit,
Yeah.
right? Where is your boundary of like, okay, I like, whether that's I want to do this once, great. If it's like I'll do it 10 times,
Sure.
okay, but we do have to look at, right, like what is best for you and for your life and your overall well-being. And again, going back to grief, right? Like there's a lot of grief and maybe my reproductive story is changing, like I really wanted children and I can't have them. So what does that look like, right? How do I make meaning? And I wanted this thing to have meaning in my life and I can't get it. So what does shifting that look
Yeah.
like, right? And how do we cope with that, right? How do I understand what my limit is? And then how do I cope with it and move
Yeah.
forward?
Yeah, absolutely. And there's power as hard as boundaries are or limitations, there's power in it. That's easy for me to say when I'm not setting the boundary, right? But there really is, and I think it wraps it around as in why, like, having someone who is trained and specializes in, specifically, obviously, maternal mental health, but specifically infertility and IVF is so important to go through this journey with you because we've been taught to be so disconnected from that part of our body for so long that we need assistance and resources, right? To be back in. And I know I flipped this because I made that, with the if IVF doesn't work out. One other flip though, because I've had patients like this, IVF or, the fertility journey has changed and there has been success. And there's birth live humans living in their home, live children. But I find that there's almost like when I used to work in pediatric oncology, we'd call it late effects. What chemotherapy and stuff would do to the brain down the road. I almost feel like there's some late effects in the treatment, maybe not necessarily the treatment itself, but the journey. Does that make sense? Do you see that in your story or others? And give us insight into that.
Yeah, yeah. I mean, so as you were saying that, one of the things that popped into my head was you're more prone for perinatal,
Mhm.
postpartum mood and
Yes.
anxiety disorder if you've gone through infertility, right? So
Yes.
oftentimes because it was so challenging to get pregnant and there's all kinds of mental health, that comes up, stuff that comes up during that process, right? I think there's so much focus on getting pregnant, right? When it's like, okay, now I'm pregnant. I thought I would feel better,
Yeah.
right? But it's like there's so much anxiety that's continuing to come up because, okay, I made it to my 6-week ultrasound. I made it to my 8-week ultrasound. Well, now I graduated and I'm at my OB's office and I don't get every other week ultrasounds, and now I'm stressed, right? And subchorionic hematomas are much more common with IVF, which they lead to bleeding, really heavy bleeding. And so that is really stressful too. Obviously, any
Yeah.
bleeding during pregnancy is stressful, right? So there's the pregnancy and the anxiety and stress of that on top of, right, once you have your baby, right, then we've opened up the can of
That's
worms
right.
that is postpartum mood and anxiety disorders. But on top of that, right, I've worked with a lot of women who, okay, I got pregnant, I have my children, but also, man, I still feel upset when somebody can get pregnant naturally, right? Or I
Yeah.
still, like I still don't really want to go to that baby shower. I still feel like people forgot, right? They forgot that they think just because I was able to get pregnant that I'm cured, right?
Yeah.
And we'll see that with secondary or when someone's trying to get pregnant again, if they've gone through infertility, right? People and they had successfully had a live birth, they have a baby. People, are like, "Oh, when are you going to have another one?" As if it's going to be simple,
Yeah.
right? Like as if I'm cured, right? Because, "Oh yeah, I had a baby, I can do it again."
Got better.
Right, exactly. Yeah, and so that too. I think and I also will see it come up with sometimes it can be tricky too as and I'm sure people have experienced this. When you have children, sometimes it can be really hard to make friends, like mom friends,
Yeah.
and then also your kids have to drive, and then that can be tricky. But feeling really triggered about seeing some of the comments that people will make about their own children, right?
Sure.
Of like almost taking for granted, right? Like, or people will say like, "Oh, like you want mine?" Like, "Are you sure you really want
Yeah.
kids? You want my kids?" Yeah, there can be things that kind of
Mhm.
continue to come up long after birth.
Yeah, absolutely. And I thank you for just like bringing it into really a normalization of this is your body keeps the score, your brain has a snap. I mean, going through all your things, right? We've taken a Polaroid and the body's holding the message and it will continue to come up. From your perspective, when we're through to that part, okay, what do you want that woman to do? Like, how can she
Mm.
help her mind and body at that point when she is still, I guess we could say, triggered by certain things out there?
Yeah. So, yeah, I mean, I want to understand like what's coming up,
Yeah.
right? Like why is that still so activating? Oftentimes it's grief, right?
Mhm.
And or unresolved trauma, right?
Sure.
Like our body's remembering because I think we, unfortunately women really tend to like white knuckle through
Yeah.
infertility because they just want a baby, right? So we're not stopping and pausing. We're like, "Yep, okay, this is the plan. Let's
Yeah.
go." And we're not ever stopping and saying, "Wait a minute, like this is really hard
Yeah.
on my body and my whole system." And so sometimes it's going back and like, okay, let's work through it. Like, yes, you have your baby, but did we ever stop to process what you went through?
Right.
Did we ever stop and really look at what came up in your body? Like how's your body feeling?
Yeah.
We carry so much that we don't
I
realize,
know.
right? There's so much tension and trauma and stress that gets stored in our bodies. So
Yeah.
what I want them to know is like even if you have your babies or baby, right? Um, it is okay
Yeah.
if you still feel a little bit stuck in that
Yeah.
infertility, in the pain of that.
Yeah.
And we can work through that.
Yeah. And I think there's like that hope piece. Like
Yeah.
you can work through I mean, there are resources, there are magnificent providers such as yourself who help bring this, yeah, all together to where you're at now. And I think that's a beautiful thing. Wow. I've learned so much in what, I don't know, like
Good.
37 minutes. This is amazing. Anything that, we sort of went through that process and
Hmm.
obviously really honing in that grief, 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 grief. Like we've
Yeah.
got to
Yeah.
give grief space because it's everywhere all the time, especially in womanhood and motherhood. Like,
Yes.
yes, like I just talked about this another thing, but like my photo app keeps giving me memories, and like that alone, even though they were happy, beautiful memories, I'm like, time is where has it gone? And that I have to feel that grief versus I just like turn the app off, turn it off. And so it's all around us.
I think, one thing I will say is I do think I talked a lot about IVF
Yeah,
and that's not everyone's comfort level, right? And so I think I want to make space for you can be experiencing infertility and not going through
that's
IVF.
right.
I think that's what everybody jumps to. They
Yeah.
hear infertility and they think, okay, you're going to do IVF. And there's a lot of in between, right?
Yeah.
There's a lot of in between, especially if we have unexplained infertility where it's like, okay, well, we'll just keep trying, and just even the like what years and years of taking pregnancy tests and getting negatives, right, over and over can do to you. And I guess I just want to make sure we're acknowledging that and making space for
Absolutely.
that too.
No,
Yeah.
absolutely.
Sure. Sometimes it's not just like I can't get pregnant. Sometimes it's I can't stay pregnant,
Yeah. Yeah.
you know?
Absolutely.
Like I can get pregnant, but I can't stay pregnant,
Yeah.
and that could be because of a clotting disorder. It could be because we don't have enough progesterone, right? That could be, I mean, I'm not 0 days of medical school
No,
under
right.
my belt, but
But a
you
lot,
know,
yeah, you're right.
yeah, yeah, it can, it's not just limited to I can't get pregnant.
If you could rewind your infertility journey and at some point when you knew, I don't know what
Mhm.
that would have been, what time you would have been like, okay, that like I didn't get pregnant the first month, whatever that looked
Yeah.
like, where you thought there needs to be more
Yeah.
intervention. Could it have been different for you? Like, would you have gotten resources like
Mhm.
yourself or now I just interviewed a nurse practitioner who's like a infertility consultant, and she just helps you ask the right questions. Like, would you have done it different? And how so?
I wouldn't change it because I have 2 children.
Yes. Right.
I'm very fortunate to have 2 children,
Yes.
but, yeah, I think I was in that place of, like, I've wanted this for so long, like, I'm so desperate, like,
It's just
okay, we should do IVF, let's do IVF,
yeah.
right? And I now knowing what I
Yeah.
do, right, having kind of tried to really get in the weeds with training and things,
Yeah.
I wish I would have slowed down. I wish I
Totally.
would have asked more questions. I wish I would have, even just gotten a second consult to say, "Hey, is this provider's opinion different?"
Yeah.
What are our options? What can we look at? So I think, yeah, I wish I would have slowed down, which I think is really hard because when you're in infertility,
Mhm.
you feel like there's so much waiting. You're
Sure.
constantly waiting for I'm on the wait list for my appointment right now. I'm waiting for my cycle to start. Now
Yes.
I'm waiting, I'm waiting for this appointment. Oh, I have to wait for my transfer. So you're already like, okay, like I don't want to do any more waiting.
Yeah.
So to say just slow down feels a
Yeah.
little bit a little bit contradictory, but I think that is one thing I wish and maybe I would have chosen the same path, right? At the
Sure.
end of the day, but yeah, I don't think I asked enough questions or advocated for
Yeah.
myself or for with my spouse and I together. I think we were just like, okay,
Yeah.
and I wish that maybe is the one thing I would have done a
Yeah.
little bit differently. Yeah, just gotten
Absolutely.
gotten more information.
No, and I thank you for sharing. So, and I know now you are the more information.
Yeah.
So, which is beautiful, but for those who are not, like, where should they go? Should they find a you? Should they find this, what's their resources?
Yes, finding somebody that you feel comfortable with kind of just
Yeah.
exploring with, whether that's a therapist, whether that is, okay, I feel really connected to this nurse at my clinic.
Sure.
Yes, like what, or if it's even like asking your doctor, if you have a good relationship with your doctor, I mean, they can say, hey, I don't have this information, but here's who you could talk to,
Yeah.
right? And, resolve.org is they're great at advocacy for
Okay.
fertility. And even just there, there's tons of information
Yeah.
out there. ASRM, the website has tons of information for patients and for clients. So I think just yes. So whoever it is, I think it's like just if it doesn't feel right or sit right, that's okay. I mean, I had a new client a couple weeks ago who came in and we had not a great experience with their consult
Sure.
with their doctor and. I was kind of asking them questions and she was like, why didn't anybody tell me this? Like, you're the first person to ask to tell me this, to ask. So I think if you feel lost, that's not how you're supposed to feel,
Yeah.
right? Like, so definitely um, don't settle. Like there is information, and you deserve to have every bit of it. Yeah.
Absolutely. I love it.
Said if you're lost, you're not supposed to feel
Yeah,
that
you're
way.
lost.
Yeah.
God, you're like bumper sticker queen today. We need to print some of these suckers out and just start passing them with like KK on the like your initials on the side. Absolutely. And I think that's the biggest, to sort of sum up all of Unsaid, the whole podcast in itself is it's for women. We did perimenopause. We're doing all the things, but the bottom line is like you don't have to suffer in silence. Like, there is growing.
Yes.
Is it still minuscule in the grand scheme? Yes. Like but we're growing research and knowledge and advocates and providers. Like there's info coming out of our ears online. Like if at least we slow down to research that and just better know what is out there for us. Anything
Yeah.
else, Catie, that you feel? I think all of this was fantastic.
I had so much fun. I appreciate getting to talk to you about all
Yes,
this.
we're so grateful to have you. In our description, I will list all of Catie's handles and her website, but go visit her. I'm gonna follow her, so let's like and comment and see what she's got so we can learn more. Everything is Catie Kirkenmeier. So CatieKirkenmeier'stherapy.com, her handle and Instagram, but I will have that all clickable through. And we're just honestly from a mom to a mom and a woman to a woman. Thank you for the work that you're doing. We need
Yeah,
more
thanks.
powerful
Yeah,
information out there on how to help ourselves. So thank you for joining
thank
us.
you.
And
Yeah, thanks for having
yes,
me.
yes, we appreciate it.
Yeah.
And listeners, if you need anything from us, we're around. Otherwise, be kind to one another, and we'll be back soon.